Lung cancer is the second most common cancer in both men and women in the U.S., and according to the American Cancer Society, it accounts for about 1 in 5 cancer deaths. On a more positive note, the number of new lung cancer cases continues to decrease, partly because more people are quitting smoking or not starting at all. And we're also making advances in early detection and treatment. Well, we're checking in today with Dr. Brian Witt with Mercy Pulmonology Clinic. He's a pulmonologist and critical care physician. Thanks for joining us today, Dr. Witt.
Nice to be here, Karen.
First of all, how does lung cancer affect a person's lungs?
Yes, so lung cancer takes up the normal lung, and it will eventually grow and cause breathing problems and lead to shortness of breath and issues with exchanging oxygen in the lungs. There is an inflammatory response with that, symptoms developing from that, and it can also spread throughout the body. So basically it takes up normal lung.
And there's different types of lung cancer. Can you talk a little bit about that?
Yes, so two broad types, small cell lung cancer and non-small cell lung cancer. The differences are small cell lung cancer is almost exclusively associated with smoking. Non-small cell lung cancer also associated with smoking but can affect non-smokers as well. Small cell lung cancer is typically caught later in the stage, and it tends to spread more rapidly, and it's more aggressive.
So what are the signs and symptoms that folks should be looking out for?
The most common symptoms would be shortness of breath, also a cough that's unexplainable and won't go away. Coughing up blood is a very significant finding and needs to be addressed right away anytime that happens. Fatigue, unexplained weight loss. So those are the main symptoms.
And so if someone is experiencing some of these things, what would be their next course of action? Let's talk about screening and such.
When we're talking about lung cancer screening, we're trying to catch patients before their symptoms. Because often when there's symptoms, that means that there's a late stage. So there is, in the past few years, there is a new recommendation to screen patients that are high risk. The number one thing is being a smoker. And then combine that with age, that leads the guidelines to who should get screened for cancer.
And what does screening look like?
It's a CAT scan. So this is not an MRI where you're in a tube, in a dark tube. This is just I explain it to patients as a donut, and it's open, and you go right through. It takes less than a minute for the scan, and it uses about a quarter of the radiation that's used for normal CAT scans. So when we say low-dose screening CAT scan, I know that can seem like a lot of words, but basically that's saying that it's using lower radiation.
So if you're scanning as fact-finding kind of situation, is that covered by insurance?
Yes, for screening, yes.
Okay.
Yes, it is. So there is criteria, so we can't screen everybody that's been smoking because that would just be too many people. And there are risks to screening because if you look for things, you're bound to find things, especially in this part of the country with the dust in the air and mold, fungus, things like that. There are things that look like cancer that aren't cancer. So we try to find the most high-risk patients, and that would be patients from age 50 to 77. And then in the new guideline, it's up to 80. But for Medicare, Medicaid, and CMS inclusive, that is 50 to 77 is the age. And with 20 pack year smoking or more. So 20 pack years means you take how many years you've been smoking, multiply that by the number of packs, and if that's 20 or greater, and you fit in that age, then you'd be eligible for screening.
If lung cancer is detected through screening, then what are the basic treatment options that people might have?
The treatments depend on the stage. And the staging is done with other CAT scans, different types of biopsies. And that is working with a pulmonologist and a cancer doctor and a thoracic surgeon and a radiation oncologist. So because there's so many teams involved, we actually meet every week, every Thursday, And we discuss patients that are newly diagnosed or that we think have worrisome signs and symptoms, and we discuss the plan of action from there. So it all depends on the stage. If it's early stage, the typical route is surgery to remove the cancer. That's potentially curative. And if it's an intermediate stage, then maybe surgery and radiation, maybe chemotherapy, and then if it's a late stage, it's usually chemotherapy, radiation.
If someone has been smoking and they stop, can those effects of smoking be reversed?
To an extent, yes. So looking at the risk data for smokers, I'm going to take, for instance, a 65-year-old that has been smoking since they were 20 years old. And if you're someone that's still smoking, your risk of cancer is about 5 to 6%. But if you were to stop 10 years ago, your risk would drop to around 4%. 20 years ago, if you were to stop, it would approach 0. So after 15 years of stopping smoking, the risk really goes down, close to 0. I can't say 0, but it's very close.
So always probably good advice that people should stop smoking no matter how long they've been smoking.
Absolutely.
It's worth stopping.
Absolutely. Each year you stop smoking, your risk of lung cancer drops significantly.
For people who want more information, they can go to mercycare.org/lung and find out more. Dr. Witt, thanks for joining us for this conversation today. Appreciate it.
Well, thank you very much. Thanks for having me.